Ginger is a wonderful spice that can add a kick to your dishes and a boost to your health. It has been used for centuries as a natural remedy for various conditions, such as nausea, indigestion, inflammation, and infections. But did you know that ginger is not for everyone? In fact, there are some people who should avoid ginger or use very small dosages. So in this video, we will talk about 7 groups of them and why they should avoid it. So without further ado, let's dive in. Number 1. People with bleeding disorders or taking blood thinners. Ginger can act as a natural anticoagulant, meaning it can improve blood circulation and prevent blood clots from forming. This can be beneficial for people who are at risk of stroke or heart attack, but it can also be dangerous for people who are already taking blood thinners like warfarin or aspirin. This is because ginger can thin out their blood more, which increases the risk of bleeding and bruising and interfere with the blood tests that monitor the dosage of these drugs. If you are taking any blood thinners, you should consult your doctor before using ginger and limit your intake of ginger in food to no more than 4 grams per day. Number 2. People who need to gain weight. Ginger is a great metabolism booster and appetite suppressant, which can help you lose weight and burn fat. But if you are underweight or have an eating disorder, ginger can make your condition worse by reducing your calorie intake, suppressing your appetite, and also by increasing your energy expenditure or the amount of calories your body burns every day. So if you need to gain weight, you should avoid ginger or use it sparingly. Number 3. People who take certain medications. Ginger can lower blood sugar levels, which can be helpful for people with diabetes or prediabetes. However, if you are taking any anti-diabetic medications like metformin or insulin, ginger can cause your blood sugar to drop too low. This can cause symptoms like dizziness, weakness, confusion, and even coma. Other than that, ginger can also lower blood pressure by relaxing the blood vessels and improving blood circulation. This can be beneficial for people with hypertension or high blood pressure. However, if you are taking any blood pressure medications like calcium channel blockers, beta blockers, or angiotensin-converting enzyme inhibitors, ginger can cause your blood pressure to drop too low. So if you are taking any anti-diabetic or blood pressure medications, you should inform your doctor and monitor your blood sugar and pressure closely. You should also avoid taking ginger supplements on an empty stomach or before bedtime. Number 4. People who have sensitive stomachs. Ginger can improve digestion and reduce gas and bloating by stimulating the secretion of digestive enzymes and relaxing the muscles of the gastrointestinal tract. However, some people may have sensitive stomachs that cannot tolerate the spicy flavor of ginger. This can cause symptoms such as heartburn, diarrhea, stomach pain, or irritation. So if you have a sensitive stomach, you should use ginger in very small amounts or avoid it altogether. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. People with gallstones. Ginger can stimulate the production of bile, which is a fluid that helps digest fats and oils. Bile is made in the liver and stored in the gallbladder, which is a small organ under the liver. If you have gallstones, which are hard deposits of cholesterol or other substances in the gallbladder, ginger can cause more bile to be produced and released into the digestive tract. This can trigger a gallbladder attack, which is a sudden and severe pain in the upper right abdomen. So if you have gallstones or a history of gallbladder problems, you should avoid ginger or use it with caution. Number 6. Pregnant and breastfeeding women. Ginger can help relieve morning sickness and nausea during pregnancy, but it can also cause contractions and affect the hormones of the fetus. Some studies suggest that ginger may increase the risk of miscarriage or birth defects, especially if taken in high doses or during the last trimester of pregnancy. Ginger can also pass into breast milk and affect the baby's digestive system, so nursing mothers should be careful with ginger intake. If you are pregnant or breastfeeding, you should talk to your doctor before using ginger or ginger supplements. Number 7. People who are allergic to ginger. Ginger is generally safe for most people, but some people may have an allergic reaction to it. This can cause symptoms such as hives, itching, swelling, difficulty breathing, or anaphylaxis, which is a life-threatening reaction. If you are allergic to ginger or any other members of the same plant family, such as turmeric or cardamom, you should avoid using them at all costs. Now that you know who should not consume ginger, let's talk about the health benefits of ginger for those who can enjoy it safely. Ginger has many amazing compounds and properties that can help you prevent and treat various health issues. So some of the health benefits of ginger are: number 1. It helps with nausea. Whether you're feeling sick from chemotherapy, pregnancy, or motion sickness, ginger can ease your discomfort. Ginger contains gingerol, a compound that helps food move faster through your stomach and reduces the feeling of nausea. You can sip some ginger tea, chew on some candied ginger, or take a ginger supplement to get some relief. Number 2. It fights inflammation. Inflammation is your body's natural response to injury or infection, but sometimes it can get out of control and cause problems like arthritis, asthma, or allergies. Ginger has anti-inflammatory properties that can help calm down your immune system and reduce pain and swelling. Some studies have shown that ginger can be as effective as ibuprofen in relieving arthritis pain. Number 3. It lowers your cholesterol. Cholesterol is a type of fat that circulates in your blood and helps your body make hormones and cell membranes. But too much cholesterol, especially the bad LDL kind, can clog up your arteries and increase your risk of heart disease. Ginger can help lower your cholesterol levels by interfering with the production and absorption of cholesterol in your liver and intestines. One review of 26 trials found that ginger consumption significantly reduced triglycerides and bad LDL cholesterol while increasing good HDL cholesterol. Number 4. It protects against cancer. Cancer is a disease that occurs when cells grow abnormally and spread to other parts of the body. Ginger has anti-cancer properties that can help prevent or slow down the growth of cancer cells. This is because ginger contains compounds called gingerols and shogols, which can trigger cell death, stop blood vessel formation, and block inflammation in various types of cancer, such as colorectal, pancreatic, and liver cancer. Number 5. It improves your brain function. As you age, your brain may lose some of its ability to process information, remember things, and learn new skills. This is partly due to oxidative stress and inflammation, which can damage your brain cells and impair their function. But ginger can actually help protect your brain from these harmful effects by boosting your antioxidant defenses and reducing inflammation. Some studies suggest that ginger may also enhance your cognitive performance, mood, and attention. Number 6. It fights infections. Infections are caused by microorganisms that invade your body and cause harm. Ginger has antimicrobial properties that can help fight off these invaders and keep you healthy. So it can kill bacteria, fungi, and viruses that cause common infections like colds, flu, sore throat, urinary tract infections, and fungal skin infections. So as you can see, ginger is a powerful spice that can offer you many health benefits. But remember, not everyone can use ginger safely. If you belong to any of the 7 groups of people who should avoid ginger or use it with caution, you should consult your doctor before using ginger or ginger supplements. Otherwise, you can enjoy ginger in moderation and reap its amazing benefits for your health and well-being. Now, we want to hear from you. Did you experience some side effects from using ginger before? Do you have some good ginger recipes? Share them with us in the comments below. We love to hear from you. Thanks for watching.